I want to give Channel 13 some big kudos for what they did on Medicaid expansion to the Affordable Care Act. Unfortunately, it's a bit too late. The session is almost over in Congress. But they interviewed Joe Freudenberger, the CEO of Oakland Medical Center, and listen to what he had to say about insurance in Texas. We are the worst state when it comes to having uninsured people. Check this out.
We have the dubious honor of being the least insured state in the United States, which is not a proud distinction.
Now, it is interesting, right? It is interesting. The excuse that David Balat, I want you to listen to David Balat. He's right on healthcare. What a name, right on healthcare. Listen to what he had to say as far as the reason why we shouldn't take the Medicaid expansion to the Affordable Care Act. Again, 40 states take it because all these states right now have paid their money into it. Listen to what he said as far as why it is that we shouldn't take the Medicaid expansion to the Affordable Care Act.
Medicaid expansion is extending that out to able-bodied adults. We have to take into consideration those people who are most vulnerable that would be crowded out by the added folks into the program with an already limited supply of physicians and facilities.
What is extremely sad about that is that he's telling you, well, there are not enough doctors or it would overburden the system. What a pot of crap that is. First of all, when people are getting ready to die, those that have no insurance right now because they don't have the expanded health care, you know what? The system still has to take them. When they get into the emergency room, the system has to take them. The only difference here is the system will milk that person for whatever they're worth, and then the state has to come up with the rest. Now, I want you to understand this. This is the most inhumane thing one could possibly do, to give as an excuse that you are not going to provide health care to some because for some unforeseen reason, they won't be able to be seen. And it seems to me like what you should be saying is, if we don't have enough doctors, get doctors trained. If our healthcare system cannot take care of the people within the country, then we have a failed healthcare system. If the services that your country provides cannot handle everybody in that country, it is a failed system. You cannot have the best healthcare system in the world if, for some reason, everybody doesn't have healthcare. Now, if you want to understand what's worse in this entire system, understand this. The way the Medicaid system works right now, the federal government pays for 60% of it, and the state has to pay 40% of it. If a state decides to accept the Medicaid expansion to the Affordable Care Act, that changes completely. The state will have to insure more people, but the state is only responsible for 10% of the cost. The federal government is responsible for 90% of the cost. Why is that? All the states, whether you accept Medicaid expansion to the Affordable Care Act or not, you are all paying the taxes that covers the Affordable Care Act. You're still paying the taxes, whether you accept the Medicaid expansion or not. It is an ideological thing in Texas. In the 10 remaining red states that refuse to accept the Medicaid expansion to the Affordable Care Act, they prefer to have their citizens dead. They prefer to have their citizens virtually murdered than to provide them the health care that is there for them to have. It is hard to understand why the media. I was completely impressed with the coverage that Channel 13 just gave the issue. They did it in a completely cogent manner. Of course, they cannot speak to some of the issues that we can speak here at, because again, we're independent. We're not dependent on ads from corporations or from anything like that. The government can't control the things that we say. They can't shut down our FCC license or anything like that. It behooves me that most Texans that continue to vote for those charlatans, that continue to vote for those evil people in Austin, don't understand that the monies are there for them to use. The monies are there. Listen to this little piece from the Channel 13 piece as well. It is so important that we understand this concept. It is so important that folks understand that it is a choice we are making to kill Texans who get sick. We are making that choice because of those we decided to elect, for those who we decided to believe. Check this out.
Right now, the federal government pays for 60% of Texas's Medicaid program, with the state picking up the rest of the cost. Under expanded Medicaid, the feds would pay for 90% of the program, with the state only having to contribute 10%.
Now, we have Texas Senator Nathan Johnson. He's been pushing to attempt to put some soul, to put some humanity, to put some humaneness into these Republicans in the state legislature in Texas. Please provide folks with health care. It's a travesty that we, the country that likes to claim that we have the best healthcare system in the world, in a country, in a state that has the medical center where people fly from all over who have the means to pay, come here to pay for services Texans can't use. People, listen to what the Texas senator had to say.
What we're talking about is taking the tax dollars that we're all paying in federal income tax that go off to Washington, that are currently being sent to 40 other states to cover healthcare costs, but not to Texas. It's a tragic failure of vision on the part of the politics of the state.
Earlier on my internet show yesterday, one of the listeners said, we can't do anything. It's the government and we don't have control of the government. To which I told him, that is the saddest thing that I've heard all day. We do have control. If we did not elect Dan Patrick, if instead we elected Michael Collier as our lieutenant governor, the most powerful elected office in the state of Texas, if instead of electing that crook that we have as the governor of Texas, Greg Abbott, if we had elected instead Beto O'Rourke, we would have had Medicare expansion to the Affordable Care Act. All those rural hospitals that continue to close around Texas would remain open. All those hospitals that have already closed in Texas would get a rebirth. All those people in rural areas, in urban areas without health care, suddenly they could see a doctor. And don't tell me we don't have enough doctors, because if you're telling me we don't have enough doctors, what you're saying is you have relegated a segment of your population to live a life of illness and death. We have to call it out as it is. It's a failed governmental system that prevents Texans from having access to health care that is there for them to have, except that the politicians that they elected, the Republican politicians that they elected, decided to deny them care, decided to deny them health care, decided to put a death sentence on a large percentage of the population, much of whom voted for them. we spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.